Good day everyone, I'm Ajebrobi Ifeanyi Precious, an expert in environmental biology and community health. Now, in my previous video, I talked about tuberculosis. I talked about how every cough is not coronavirus. We talked about the symptoms of tuberculosis and the diagnosis of tuberculosis. Now, with respect to that video, we had a patient that had the symptoms, and after tests, she realized she had pulmonary tuberculosis. Now, that brought to the urge to talk about what to do when you do diagnose that you have tuberculosis. Now, before we get to what to do when you diagnose you have tuberculosis, there are two phases of tuberculosis actually. There's the latent phase and there's the active phase. Now, this latent phase is a phase where peradventure you came in contact with someone who already has the bacteria in them, and now you're infected. You have the bacteria in you, but they are not replicating. It's not producing more bacteria in your body, it's just there. And now this as a result of your immune system. This is because at this point your immune system can keep the replication in check and make sure that they are not replicating. Now, in this latent phase, you're not contagious, you don't feel any symptom, you're asymptomatic, you're not sick, you're not coughing. Now, this latent phase can move to the active phase. Now, in this active phase, this is where you become symptomatic. This is where you start coughing, you become sick, and all the symptoms of tuberculosis start coming in. Now, this is more reason why even when you have the latent phase of tuberculosis and you're asymptomatic, you're not sick, it still needs to be treated because it can move to the active stage. Now, if you're already in the active stage and you're undergoing treatments, you still need some precautionary measures to take to ensure that your treatment is complete and also ensure that the bacteria is not being spread. Now, the fact that you started treatment doesn't make you or doesn't stop you from being contagious. You started treatment right, but you're still contagious few weeks after you started treatments. Now, after you started treatment, the first thing to do is to isolate yourself, because at this point you're contagious. Like I said, stay away from family and friends, stay away from people, stay in environments that are well ventilated, because those bacteria breed well in tight environment that lack fresh air. So always make sure you stay away from people. If you get to the point where you are no longer contagious and you can live your normal life, your doctor is going to let you know about that. So until that, keep yourself isolated. Now, aside that, whenever you're coughing, whenever you're sneezing, make sure you have a tissue. So you're coughing into the tissue, you're sneezing into the tissue, and you're disposing that tissue immediately in a plastic bag. Do not leave them littered. Like I said, tuberculosis is airborne, it can spread through air, so do not make sure they are not littered in the environment. And another thing is, treatment of tuberculosis has to be complete. That is, do not skip your medications. Just like I said in the previous video, when you skip your medications, you're giving the bacteria the room for resistance, and once this happens, it's going to be very difficult for you to get treated of tuberculosis. Now, how can you ensure that you do not skip your medication? The first one is the DOT. We call this the directly observed therapy. This is where you book an appointment with your health practitioner, either on a daily basis or a couple of times in a week, where you go to the hospital, you meet your health practitioner, and you take your medications right in their front. Now, if your schedule is too tight and you cannot do this, you can also do this on your own at home, either by setting a daily alarm to remind you when to take a drug, either by attaching you're taking a drug to your daily activities, maybe like brushing. You already set the time for yourself that, oh, whenever I want to brush, before I brush I must take my drug, so after I brush I must take my drug. This way you find out you're not going to skip your drugs. You can also tell family and friends to remind you when to take your drugs. With all this being said, I believe these informations are useful to those who don't have tuberculosis, and most importantly to those who have tuberculosis. Stay tuned for more videos. Thank you.